Hey guys, my name is Dan and I'm going to be doing a quick presentation on early onset osteoarthritis in athletes. So a good place to start is going to be defining the population in question. With so many different definitions, it's important to establish a working definition for athletes in order to understand the nature of the problem being discussed. For the sake of this presentation, I will be defining an athlete as an individual that competes in a physical sport. Athletes also have a higher risk of traumatic injuries and altered mental health. It is important to note that arthritis is a general medical term for inflammation surrounding a joint, so the pathology we will be specifically discussing is osteoarthritis. This occurs when there is degradation of the articular cartilage in the joint, causing friction that instigates an inflammatory response. This can lead to prolonged pain around the joint during symptomatic cases. I will be specifically discussing the early onset variant, meaning it has developed at an earlier age than considered standard, which is under 50 years of age. It is thought that a potential mechanism for early onset osteoarthritis is traumatic injuries such as soft tissue ruptures or bone fractures. Examples could be ligamentous tears and sprains or stress fractures occurring over the metatarsals of the feet. Altered biomechanics along with additional physiological stress might also contribute. This is different from the standard wear and tear associated with arthritis among older populations. So the reason why this particular pathology is relevant to athletes is due to the increased rates among athletes when compared to general populations. About 59% of former elite athletes have been diagnosed with osteoarthritis in one particular study. Needless to say, chronic pain reduces quality of life and leads to other potential psychopathologies such as depression or anxiety. As previously mentioned, the reason why athletes are more at risk is due to the increased amount of physiological stress and traumatic musculoskeletal injuries that they endure. These are strong risk factors for early onset osteoarthritis. The best way for us to treat this issue is through prevention. While there might be medical treatments available, nothing is more effective than preventing an athlete from developing this condition in the first place. It is through the combined work of different sports medicine professionals that this condition can be adequately prevented or managed. These professionals include, but are not limited to, exercise physiologists, athletic trainers, sports psychologists, physical therapists, nutritionists, and biomechanists. Through strengthening surrounding musculature and preventing altered biomechanics, risk of injury can be greatly reduced. It is my hope that holistic care for athletes can prevent this and many other unique pathologies that athletes face. Now here's just a list of references used during the presentation.